My name is Kayce Glattke.
And I'm Tummula. We'll be talking about our study today. There's substantial variation in rehabilitation protocol following ACL reconstruction. We surveyed 46 American orthopedic surgeons. This is recently published in Arthroscopy. So the real goal of the study was to evaluate how orthopedic surgeons look at their ACL rehabilitation protocol. We wanted to get a really in-depth understanding of some of the things that they emphasize and some of the time points that they're using. We looked at 8 topics, as you can see on this slide, and we distributed this to AOSSM and ANA members who performed at least 20 ACL reconstructions for a year. The majority of our surgeons that we looked at here were in practice for more than 16 years in an academic or teaching hospital.
So one of the interesting things that we looked at in this study was asking whether these respondents use quantitative assessment technology as part of their rehab protocols. And so we found that some did, mostly isokinetic dynamometry and video recording. However, a lot of our participants responded that there was a lot of factors that limit their use of this technology in practice. So that really boiled down to lack of resources such as finances, time for training, and staff available to actually complete the use of the technology.
When you look specifically at postoperative recovery, the modalities that a lot of these surgeons are using, I think this kind of highlights some of the general trends that the field has been going in. More surgeons are allowing immediate mobilization. More surgeons are kind of moving away from CPM type of therapies, and I think some of the controversies still are more surgeons allowing home-based rehabilitation therapies, protocols, or wanting in-person kind of visits, and then the idea of bracing as well. A lot of surgeons are still bracing despite being, literature kind of suggesting that may not be necessary in the postoperative period.
So we also asked when these surgeons are typically allowing their patients to advance through the phases of returning to sport. So we looked at returning to jogging and lateral movement, non-contact, and then unrestricted sport. So there was some variation here, with majority responding 3 to 4 months for jogging lateral movement, 6 to 8 months for non-contact, and then at least 9 months or more to unrestricted sport. But you can see there are still a couple outliers, which really is a testament to the fact that there's still no golden standard for when patients should be going back to sport after surgery.
So when you think about the use of strength testing in rehabilitation, this is really something driven largely by physical therapists when they're kind of analyzing the limb symmetry indices, and then also using different modalities to test. And I think one of the things that really stands out from this data is a lot of surgeons really like to use manual muscle testing early on in their early progressions to sport, through jogging, lateral movement, non-contact sport. But then later on, emphasis is really on isokinetic testing. And then when you look at the overall progression, majority of these surgeons like to see an LSI greater than 90% before they're returning to the sport.
And then we kind of see some of these patterns in the use of functional testing as well. So you can see that the battery of hop testing is pretty popular as patients move closer to returning to unrestricted sport, with Y balance thrown in there as well. And then same deal with the LSI of strength testing, that LSI greater than 90% is still kind of what's accepted as the criteria for advancing to unrestricted sport.
So what is the single most important factor? This is something we wanted to ask, our surgeons, just to see what they thought and what they really value when you think about, progression through rehab and also progression to return to sport. And not surprisingly, the majority of these surgeons wanted to look at functional testing and seeing how that limb performs to the opposite limb, particularly using a limb symmetry index. But also the time since surgery is also an important factor. I think this has really been emphasized in some of the more recent literature, particularly looking at, the emphasis on at least 9 months before return to sport, and then, that being a good time point for allowing that.
So our main takeaways here, most of our respondents reported that they believe that quantitative assessment technology could improve patient outcomes, but it's highly underutilized. Less than half of our subject population responded that they use it. And then, like Sai mentioned, the utilization of bracing, even though it's been shown in literature to not necessarily have any benefits after surgery, it's still used by quite a bit of surgeons. And then there as well, with the overwhelming lack of consensus regarding return to sport times and the LSI criteria that patients must reach for strength and functional testing before they can go back to sport. So this survey really highlighted some of those variabilities in practice, and we're excited to share this with you today. And if you have any questions, please reach out. Thank you.
Thank you.